What really happens to patients after they visit their doctor? I'm Natasha, a registered nurse and care management strategist. I help healthcare organizations implement nurse led, technology supported care management models that improve patient outcomes while increasing practice revenue. And I teach nurses how to build businesses in care management aligned with where healthcare is going. In primary care, providers are typically seeing patients for about 15 to 20 minutes. In that short time, they're expected to assess, diagnose, prescribe, educate, document, and move on. But that visit is not the end. It's just a starting point. Because once the patient leaves the office, everything else is left up to them. And that's where things start to break down. Patients leave with instructions, but they don't fully understand their diagnosis. They're confused about their medications. They forget what the provider said. And a lot of times, they're overwhelmed. Let me give you a real example. I've worked with patients who left the office with multiple new medications for conditions like hypertension and diabetes. When you follow up a few days later, they'll say, I picked up one medication. I didn't start the other one yet. I wasn't sure when to take it. Not because they don't care, but because no one followed up to make sure they understood what to do. Now, add real life on top of that. They may not have transportation, they may not have support at home, they may not be able to afford their medications, and no one is checking in. No one is asking, did you pick up your medication? Did you start taking it? Are you having any side effects? So, what happens? Medications aren't taken correctly or not taken at all. Symptoms get worse. Patients end up in the emergency room or back in the hospital. Now we're dealing with higher costs, poor outcomes, and frustrated providers. This is not a patient problem. This is a system problem. And this is exactly where care management comes in. Care management fills the gap between visits. It doesn't replace the provider, it extends the care. This is where nurses step in. The nurse care manager follows the patient after the visit and makes sure the plan of care actually gets carried out. That looks like following up with patients after visits, explaining medications in plain language, making sure prescriptions are picked up, identifying barriers like cost or transportation, coordinating care with specialists, monitoring symptoms, and educating patients over time, not just in one visit. This is ongoing support. This is relationship based care. And this is what actually drives outcomes because patients don't need more instructions. They need support implementing those instructions. Healthcare is shifting. We're moving from fee for service to value based care. Providers are no longer just paid for visits, they're being measured on outcomes. Are patients staying out of the hospital? Are chronic conditions being controlled? Are patients engaged? And you cannot achieve those outcomes in a 15-minute visit. It requires follow up, care coordination, and consistency. It also requires nurses. Care management is not extra, it is essential to improving patient health outcomes in primary care. So, if you've ever felt like something is missing in healthcare, you're right. What's missing is what happens after the doctor's visit. And that's where care management changes everything. If you're a nurse and you want to step into this space or build a business around care management, join my online school, Empower Care Academy. And if you're a provider trying to improve outcomes while increasing revenue, care management is one of the most powerful models you can implement. Make sure you like this video, subscribe to the channel, and I'll see you in the next one.